Good afternoon. I'm Brett Perlman, and welcome to the Center for Houston's Future Leadership Webcast series. For the last 8 weeks, we have been holding this webcast every Wednesday with experts on leadership, the pandemic, and other important topics. Through these conversations, we've uncovered many ideas to address the crisis and other important issues. And looking past the current situation, we're considering the implications for the future to determine what actions we as a community need to take to ensure the social, cultural, and economic well-being of the Houston region. This week, I'd like to introduce our moderator, Russell Richard, and our guest, Marvin Odum. Russell?
Thank you, Brad. Good afternoon. I'd like to welcome everyone to today's webcast. We appreciate you tuning in. I'm Russell Richard, Vice President of Leadership and Engagement with the Center for Houston's Future. The center was established in the year 2000. This year is our 20th anniversary. The center works to convene business, government, and community stakeholders in fact-based strategic planning and collaborations on issues of the greatest importance to the future of the Houston region. I'd like to take a moment to acknowledge the center's leadership alumni on the webcast today. Thank you so much for your support of the center and its work. For those who'd like more information about the center and our leadership forum, please contact me or visit our website, futurehouston.org. Our next leadership forum is scheduled for September 24th of this year. Classes already half full, so please contact me soon for more information about the program and registration. Today is the 9th in our webcast series. Last week, we discussed the reopening of Texas and the Houston region, how to reopen safely, how to recover, how to move forward and get better. Today, we want to build on that conversation and talk about how things are going as we reopen the Houston economy safely. We will have a full Q&A at the end of the conversation, so please use the Q&A feature in your Zoom app to submit your questions during the conversation. Also, please feel free to chat with others on the webcast. My guest today is Marvin Odum. Marvin is the former chair and president of Shell Oil Company from 2008 to 2016. He also served as an executive committee member for Royal Dutch Shell during the same period. Marvin was the chief recovery officer for the city of Houston following Hurricane Harvey, and now the chief relief and recovery czar. And if that's not enough to keep him busy, he has a litany of separate business, personal, and community interests. Marvin, thank you so much for joining me. It's great to have you on the webcast.
Thanks, Russell. It's good to be here, and it's good to see you again.
Well, thank you so much. Marvin, you have clearly been the go-to person for Houston during the time of crisis, first with Hurricane Harvey and now with COVID-19. I can only surmise that the pay is outstanding.
Yeah, no, it's exceptional, as a matter of fact. And I wouldn't recommend it to anyone else. How about that?
Okay, well, thank you so much, Marvin. In all seriousness, we really appreciate the work that you did during Hurricane Harvey. And all of us are extremely grateful to you for agreeing to work on COVID-19. Both events were on a scale never before seen by Houston. How do you compare your work on COVID-19 to the work with Hurricane Harvey?
Well, as you can probably imagine, there's clearly some similarities, but there's a lot of differences too. I think the main difference, if you think about Harvey, which was so just deeply devastating for portions of our community, and of course it'll never leave our minds. The difference with COVID is that it affects everybody. And it's not just everybody in our community, of course, it's everybody in the world, frankly. More so in the developed world, but it has clearly had just this very widespread impact. I think you look at COVID, and another word that comes to mind is uncertainty, right? So a hurricane is an event, it happens, you assess what you have. There's relatively well-established ways to then move through a recovery like that. With COVID, it's what's next, and it's how long is this going to last, and what is the actual impact on business? What is the actual impact on social norms and so forth? So a lot of uncertainty there that I'd say didn't exist in Harvey. Another clear difference, and it relates to the first point, is just the depth of the economic crisis that we're going through. I'm sure we'll talk about it more, but I think it's even hard to get your arms around how significant the impact is on the economy, or what exactly it will take to recover from that. I was talking to Bob Harvey the other day, and he had an interesting way of describing it as you try to bring that concept closer to home. And his comment was that Houston's a $1.5 billion a day economy. And, and about $500 million a day of that is payroll, is what everybody takes home. If you just assume that 10% of the population so far has been affected in terms of being displaced from their jobs, and we all know the number is actually higher than that. You just use averages, $50 million a day missing right off the top. That's usually comes into people's pockets. The reason why I go through those numbers is there is no amount of federal or government funding that's going to step in and replace all of that. The only thing that gets us back in this case is to get the economy going again. Mm-hmm. So I think while we're on the topic, I don't want to forget this either.
Sure.
So you've got all those things I mentioned, and we've got a crisis in the energy industry right now, which I don't need to talk too much. I know everybody's deeply familiar with that.
Sure.
But at the same time, I would say a difference is I'd say because it's so broad spread, COVID is, that there's a more cohesive response this time around. I mean, if you think about what our broader community is made up of in terms of citizens, business, our medical community predominantly in this, very predominantly in this case, nonprofits, government, the degree to which those groups have come together and gotten their minds very quickly around how do we start to address the current situation, I think is actually quite impressive and a notable difference from some of the aftermath of Harvey. And another big issue is that the different than Harvey is the money is actually here. Now, the money is kind of an odd thing to say, but you typically, after a hurricane, for federal assistance, you would wait for years, other than FEMA's immediate response. You'd wait for years for that money to come to start to make massive repairs, infrastructure changes, and that type of thing. When the mayor called and I came into this role towards the end of April, there was already close to $400 million in the bank to be spent on this crisis in particular. And so the ability to immediately turn that into actions is a difference and a big help in this case.
Mm-hmm. Mm-hmm. Well, thank you, Marvin. You mentioned a couple of things. You mentioned energy, and you also mentioned the broader Houston region. And I want to talk a little bit about both of those a little later, but thank you for bringing it up. The Houston region and the surrounding area, I think, has worked really hard and made sacrifices over the last 3 or 4 months to help flatten the curve, to not overwhelm our healthcare system. And it seems to me and others that with the reopening of Texas and the Houston region here recently, that seems to have sent a signal to some that it's all over. There's no problem. COVID-19 is behind us. What are you and the city doing to help us to not lose some of the gains that we've made over the last 2 or 3 months?
Well, I'm here today with ideas, Russell. So if you have some ideas other than what I tell you, I would welcome those. Mm-hmm. First of all, I think there's if you do look back, as you said, over the last couple of months, there's a lot for this city and this county and this region to be proud of. Mm-hmm. The response was, I think, if you take it all in context, the response was quick. And the response was pretty comprehensive, and they were very difficult decisions as you think about what was shut down and a number of things. So hard decisions to make, but clearly we have seen the impact of this. And you can talk to any medical professional in the medical center and so many different parts of our medical community, and they can describe exactly the impact that we've had. So good for us for doing that, and good for our leaders for making those choices earlier. I think maybe it's worth emphasizing just a couple of points around the impact we've seen, because I would describe the current trend as one where, we've been through our peak, we've come down, and we haven't continued to decrease, but we've plateaued at there's no good word for this. I'll just say at a level that we can manage. There's still sickness and death happening, and that's an immense tragedy. But it's from a hospital capacity, ICU standpoint, and that type of thing, we can manage it. And if you want to just, I know numbers are important for some people. So we peaked at a 7-day average of new cases of somewhere on the order of 415 cases a day, 7-day average. And then that was back, I'd say, at about mid-April. Then, not too long ago, before the reopening started, we were down to a level of about, say, 245 or so. And now we're at a level of about 270, 275. I go through that kind of those steps so that you can get a visual picture of it. And we can assess, now 30 days into the beginning of the opening, that we may well be seeing a slight increase in the number of cases due to the fact that there's more interaction and so forth. But we're also doing more testing, and I think we're going to come on to the topic of testing at some point. But we're doing more testing, which would also tend to increase those numbers. So I think there's a very strong sense, I would say, of caution, but at the same time, it actually looks like it's going reasonably well. Now we have local issues, hotspots, breakouts, and so forth that are extremely concerning and very impactful. So all of that is happening in the midst of all these averaged out numbers, but we're doing reasonably well so far. I think in order not to lose ground, as you said, there's some good news and bad news here. So the bad news is there aren't that many levers we can actually pull. The good side of that is, and I say this in the absence of a vaccine, the good side is that the tools and the levers that we have are actually very, very clear. And it just comes down to testing, contact tracing, communication, and individual behaviors. I mean, it is as simple as that. Now that has to be internalized, it has to be acted on, but I mean, it's not from that standpoint, you might say is not as complicated as it should be. If we'll come back to the testing piece, I think, and some of those other tools, but individual behavior is the one I'll focus on, based on the way you asked the question. You're right. People are getting out there, and I can feel it. I went to the store yesterday.
Sure.
Go down to Galveston occasionally, and you can just feel this relaxation of it. Seems like the big part is over with, and so forth. And I was about to walk into the drugstore, forgot to put on my mask, went back to the car, got it, and put it on. So I understand the tendency there to relax and to forget. But we have to find a way, and this is our big communication challenge, I would say, is we have to find a way to get people to internalize how important that personal behavior really is. Because we are clearly not out of the woods. You really could turn this around and get into a worse position than we were at our peak in April.
Mm-hmm.
And
sure.
that is the element that we have to fight that. So physical distancing continuing, wearing a mask continuing, all very important. I read an editorial or an article in the Wall Street Journal, I think it was last week, and it basically was talking about this whole politicization of wearing a mask, and it reframed that to a bit, which I thought was really important, and that is, actually wearing a mask says, I respect all those people around me. Mm-hmm. And the other thing it says is, I want this economy to reopen, and I want it to work. I don't want us to have to take a step back. And I think that is the message you want people to internalize around elements like wearing a mask.
Sure. No, I appreciate that, Marvin. You said a number of things. You mentioned testing and contact tracing, and I want to get to that here just a little later. But a couple of things that you mentioned that really stood out to me was getting COVID to a level that we can manage. And you also said caution, that really resonated with me. I think the general public, a large percentage of the general public, really embraced the reopening this past weekend with Memorial Day holiday. And we've all seen, I think, some pictures and some video that were a bit concerning. And I'm not sure that a lot of those people in the video and pictures were exercising caution. Do you have any concerns about that? What do you think the impact of that will be in the next 2 or 3 weeks?
Well, so yeah, a couple of things on that, Russell, and one, so to answer the question directly, I clearly do have some concerns about that. I think I can't help but have this point of view, being somebody that comes out of the energy business for a number of decades, and we always think about this concept of a safety culture. And what we recognize in some of that thinking is that individuals are not always very good assessors of risk. And I think that applies in this case. I mean, I think it's not hard to put yourself in a position to say, listen, the chances of me getting this are very, very small. It's only affecting a small portion of the population and so forth. And you can minimize that sense of risk very, very quickly. And I think to a negative end, because it's just like always, you're fine until you're not fine anymore, but you're not good at seeing the path between here and there. I'll tell you from maybe a safety culture perspective, the way I look at it when I go out, because I venture out just like a lot of the other people you see out there. And the assumption I make, particularly as I get into any closed space, is that there's someone around me that's asymptomatic, right? So they have the virus, they can share the virus, but they don't have any symptoms and they don't know that they have it. So that's just the mindset that I take and the assumption that I take. And that allows me to then think about my distancing and how I interact with people in a way that I think, certainly I think it keeps me safe, and I'd like more people to have that perspective. And you really do have to frame it in terms of thinking about, I think about our, elderly parents. Certainly, it's not about me getting sick; it's about them. I have a 7-month-old grandchild that I really desperately want to see, and so you need to put it in that context. But I think so am I concerned? Yes. What do we do about it? The main thing is to make sure that we're set up to monitor. Given we can't immediately change individual behavior, we have to be set up to monitor in an effective way so that we see trends early and that we're able to act on that as quickly as possible.
Well, I think we all share very similar concerns. I also have an aging mother, and her health is a big concern of mine. Marvin, I want to pause just for a moment and remind our viewers to please submit their questions while we're talking, and we'll get to as many of those questions as we can after the conversation. Marvin, during this first wave, community mitigation relied upon, staying at home, working safely, social distancing, and the experts and the scientists are telling us that, continued community mitigation is important, and following a very strict guidelines and increased testing and contact tracing and isolating those who have been exposed is prudent, and I agree with that. Can you talk a little bit about if the city is building new test sites and who should be tested? And can you also speak a little bit about contact tracing and how do we isolate those individuals that have been exposed?
No, those are very important questions, Russell. So let's talk about testing first. As I'd say, the primary diagnosis and monitoring tool for understanding where we are. So you don't have to go back very far. Just about a month. And if you looked at testing in the city of Houston, there were just a handful of very large sites where people could travel to and get tested. Now, I'm not faulting the way it looked then, because that centralization of sites and that limited number of sites had a lot to do with supply chain, how many tests were available. We had to move through a period of time, of course, where you basically had to have symptoms in order to get a test, to be approved to get a test and so forth. Now that supply chain has loosened up a bit. Things are more available, and it allows us to take a different approach to testing. So one of the first things that we've done, and the health department, Steve Williams and Dr. Peirce and the group over there at the City of Houston Health Department have done such an excellent job on this front, is you can see that we've gone from, say 4 centralized sites to now 27 as of last week, sites dispersed around the city. And it's a combination of fixed sites, where you would drive your car to or walk up to, and mobile sites, think of a mobile unit going to a nursing home or something like that. And even these what I call outreach teams, which are able to go and go to visit individuals who are unable to leave their home. So very much a sort of multi-pronged approach on how to do testing. I think the important part of this story is that you have to strategically think through how you place these sites. And so what we did was we understood the data in terms of where infections have been in the past, and as one element of assessing that risk going forward. We were able to overlay that with, just to use a very broad term, with a series of vulnerability index measures to identify, which neighborhoods across our city are likely in the high risk category. And those tend to be socioeconomic challenged neighborhoods. It tends to be neighborhoods where you have a lot of people that are in the service side of the industry, so they have more exposure. And you can just go on and see how you would define that vulnerability aspect. So as we place now 27 sites out there, we very specifically went after the 22 highest risk areas, communities in our city. And you will also see that we've made that testing free. So, and regardless of whether or not you have symptoms, you can come in and get a test. So free, more accessible. And what that allows us to do, not only serve the community better, but allows us to pick up as early as possible where we may be starting to see some spread. And then your question takes us right into the second key tool that we have. You identify with the testing, but then you have to find a way to contain that. And that's where the contact tracers come into place. And it's not a new methodology. It's been around forever, as far as I know. I think certainly going all the way back to the flu of 1917 or 18, whenever it was. But anyway, it's very simply the process where if somebody's identified as positive, there's a group that makes, or an individual that makes contact with them, finds out who they've been in contact with, informs those individuals. And it gives everybody the best possible chance of being informed and then taking the right actions as an individual to isolate themselves or better protect those around them. It's a purely voluntary system, so there's no way to mandate that certain behaviors out of individuals. So it's a voluntary activity. It is probably, it is the way really that you can contain the spread once it starts to break out again. So we've gone, just in terms of what the buildup looks like, we've gone from late April having maybe 120, 125 contact tracers working full time to now we're getting up near 300. And we'll probably take a pause and plateau at 300 to see if at that level, are we able to contact everyone that's identified as positive, or are we able to make those subsequent contacts and phone calls? But if we see an increase, like you said, because of the activity exampled by this last weekend, it could be we have to add more of those, more of those contact tracers. So a very, very important activity. I think it's always easy to describe these things and make it sound much simpler than it is. But the challenges with something like contact tracing are, first of all, if somebody calls my phone and I don't recognize the number, I typically don't even pick it up. I'd like to know who's calling me. So the idea of creating some trust between the people that you're trying to contact that's a skilled job, right? If you're a contact tracer and you're calling someone, it's not an easy thing, and you have to be trained on how to open that dialogue and how to build some trust there, so that you're listened to. And then you're asking that individual to share the names of all the people they've come into contact with, and you can see the challenges around trust with that. So there's a skill associated with making this happen. And then if you identify through testing and through contact tracing someone, and your message to them is, okay, you need to isolate for 2 weeks. But if you live in Gulfton and you're in an apartment with 6 other people, that's kind of a silly statement, right? You can't just isolate yourself. you don't necessarily have another place to go or be able to afford another place to go. And so you have to provide, the city has to provide, and the county has to provide some of the wraparound services that go with that contact. Like actually, if we've leased a couple of hotels and all the rooms, do we need to, provide one of those rooms to you so that you can move away from others? And, you may be leaving issues behind, so we may need to provide childcare or something else to allow that to happen. So you can see, all that said, just that it's a fairly complicated process, but one that you just have to be diligent about and get after, hour after hour. There's lots of privacy concerns associated with that, just again, to give you a sense of the challenges. You're getting people's data. And so in a world where everybody's working remotely, sort of counterintuitive, we're actually creating a very large call center where these 300 people will be sitting and have their IT tools and their phones and making those connections. And we can do that in a way that keeps them appropriately distanced and safe. But that's the way we control what I would call sensitive information, because you're dealing with people's private data.
Thank you, Marvin. Last week, one of my guests, Dr. Usaf Beaton from the Boston area, mentioned that, and he emphasized that there will be a second wave. He couldn't predict whether it would happen in the fall or the winter, but he very clearly specifically stated, it's just a matter of science and math, was his words. How concerned are you about the city's current budget troubles and hampering its ability to respond to a second wave?
Well, let me take that in two parts, Russell, because I think the first part is, okay, because that kind of logic appeals to me because I'm an engineer, and that fits very well in my sort of linear thinking to some degree. Okay. And so I can look out to the fall and I can say, okay, we're going to see a second wave. And you can ask yourself, what are we going to do about that? What that does is it brings me back to another activity that we're in the middle of right now, which also comes from my shell roots, which is doing some scenario planning around different things that could happen. Call it war games, call them tabletop exercises, whatever you want. And this is participated in by a very broad group of the community: Texas Medical Center, other medical professionals, GHB, and go on, and obviously the city governments. But the case that we've just done last week, we'll do a series of these, was, of course, in the summer. We're in the middle of a pandemic. We're seeing an area that has, some increase in infection rate, and then we have a hurricane. So then it's basically the question left on the table is, so what are you going to do? Because some of your normal ways to respond to a hurricane obviously create some issues. So are you going to put 5,000 people in a very tight space in the George R. Brown in the midst of a pandemic? Well, maybe if you don't have any other choice, but we need to pre-think what other choices could we create if we spend some time on this ahead of time. So that type of preparation, I think, is really important. Specific to the city's budget, I think the numbers are pretty well known and out there now. We're talking about, in this 2021 time period, about $170 million of gap in the budget. And this has been an education for me coming into the sort of the city environment and seeing it. I had the same education, by the way, with Harvey, so it doesn't feel new this time. But there's not a lot of slack in the city budget. And people, I would have thought, of course, I came from a very large business, and $170 million is always a lot of money. But if you had to do some things to fill a gap like that, you could do it. And I would have translated that almost mindlessly to fourth largest city in the US. Surely it has that kind of capacity. But because of a number of reasons about the way the city's financial structure is put together and so forth, that capacity is just not there. So you take $170 million out of the budget, and that means $170 million of discretionary services effectively are going to go away. And that's the debate. I noticed there was something in the paper this morning about it, in terms of what does that mean in terms of furloughs, services to the public from the city departments. and they're not small. Impacts to first responders. They're not small impacts. So it does worry me. I will tell you that the mayor does this in a very cautious, very mindful way to make sure that since we are in a pandemic, that this is not executed in a way that is going to overly impact our ability to respond. And so I feel okay about it, and again, this is in the context of somebody who's worked through Harvey and working through this. So you're working through some pretty devastating situations. But in that context, I'm not overly worried about the city's ability to respond to the pandemic if there was a resurgence in the fall from a financial point of view. But the thing that's allowed that to happen is something I mentioned at the very beginning, Russell, which is because of some of the acts in the bills passed at the federal government level, we do have a $400 million allocation that's been made to the city, which is what's paying for the testing, it's paying for the contact tracing, and it can be used for elements directly related to COVID impact. It cannot be used to fill a gap in the city's budget. So, if we had a second wave in the fall and the mayor needed to ramp up testing and contact tracing and a number of other things, there is some financial support to do that. So I think we're in about as good a shape as we could be from that perspective.
Well, Marvin, I'm glad you mentioned hurricane, because that was something that I was thinking about as we enter into hurricane season. And I'm sure you're aware of the flooding that occurred in Midland, Michigan, just roughly a week ago. So I'm glad that we're thinking about, what our response may be in the event that we do have a weather event on top of COVID-19. Marvin, let me switch gears a little bit. As we continue to move forward with this reopening phase in Texas and in the Houston region in particular, we're doing everything that we can to prevent this economic slide to the extent that we can. What can business leaders do at this moment? And can you talk a little bit also about your collaboration and coordination with the county and other counties in surrounding areas?
Yeah, this is also a very important part of what's happening out there. I think let me just think how I'll move through this. First of all, business can't be, business and the current economic environment. You have to segment that into different packages because the capabilities and the capacities there are very different. So if we think about medium to large businesses, my confidence level that they will find a way to innovate and work through and modify in a way that allows them to, get back to business actually reasonably quickly is pretty high. I mean, we've had to do it. I've had to do it a number of times. Probably everybody listening to this call has had to do it, and you do find ways to do that. I mean, I'm on the board of a company that has to send people offshore, for example, for a couple of weeks at a time. And the immediate short-term measures are because you can absolutely not afford to have a hotspot out there on an isolated platform. And so there's a process immediately that went into effect, which is those people get quarantined in a hotel. Once they've been there long enough, then they can go offshore. When they come back in, you repeat the process. That's a very short-term kind of gap or innovation to fix it, but they will come up with, through testing and other capabilities, ways to do that much more efficiently, much quicker, and so forth. And you can expand that to just about any example out there. I think it's a very different story for small businesses that don't have the financial capacity to even think through some of those things, and certainly to survive while they're doing all that. And even to the extent of, I was getting some information about, in this case, a relatively large restaurant. And when I heard the number, the amount of money they were spending every week on PPE just to supply all of their staff and to have extra supplies for their customers where something was forgotten or they needed it. Again, they figured it out. They maybe can do it, but a smaller restaurant with less capacity wouldn't be able to afford that type type of reaction. So I think we segment those pieces, and that's important in terms of how we approach a solution. I think that, business leaders out there need to really avail themselves of the resources that are there. So I'll think about a piece of work that we put a link on the City of Houston website to this. It was developed by the Greater Houston Partnership. You can find it on their website. But basically, it's how to return to work safely. I'll use that description. Segmented by the type of business, and not type like oil and gas or something else, but type in terms of what a risk assessment would be. The amount of contact you'd have with other people. Do you see a number of customers and that type of thing? And then it's basically a guideline around best practices for that kind of work environment. Also reaching out to national and international trade groups and so forth. So it's a very comprehensive view. And if somebody's thinking, how am I going to do this? Those kind of resources are out there, and they're very, very good. So I would want people to be aware of that. In terms of how, so that's kind of a business piece, and we could talk about that for a long time because there's a lot more going on, a lot more you could do there. In terms of local leaders, when I think of our political leaders, our government leaders, they almost by necessity. First of all, it's a choice, and I'm happy to see that our leaders make that choice, but they by necessity need to focus on the most vulnerable aspects of our community. And so that's not providing a lot of assistance to medium and large sized businesses and other things. And that won't surprise anybody. But we have a group now, and, the city's example is we put together a health equity response task force that tries to pull together the input and the efforts and coordinate those efforts of about 40 community organizations. So think nonprofit, faith-based groups and others, and tries to apply those to now a refined definition of what the need is, whether that's food, PPE, childcare, all the list of issues that become so important in these vulnerable communities. And I think because it's an organized, I think very smart way to approach it, it also allows the leaders of that type of activity to sit back and say, okay, how do we address these very short-term immediate issues, but in the context of, how do we fix the long-term systemic issues that cause this to be so urgent in the first place? So that kind of longer-term thinking is woven into that type of effort to get help to the most vulnerable in our communities. I think it clearly requires excellent alignment, particularly in a setting like this. You've got, one of the, fourth largest city in the country, I think maybe the largest or close to the largest county in terms of population in the country. And, I don't think about it. I don't think about when I go from the city of Houston into the county and even where those boundaries are. So it's incumbent upon those two groups to make sure that these activities are as seamless as possible. And there is a tremendous amount of coordination with the county, better than what I saw after Harvey, and very deliberate. And, it happens through meetings that we have every week on very challenging topics. So it's happening in all the right ways. And there's a gentleman named Armando Wale, who was appointed by the county, who effectively has my role in the county. And he and I talk continuously to make sure we're staying together. And of course, you've got the county judge and the mayor doing the same thing. So I'm actually very proud of the way that's working so far, because it's important that we keep it easy, as easy as possible for people out there. And then the last thing that I'll mention, Russell, is it's incumbent upon us, particularly the role that I'm in and that Armando Wale is in, to look outside of the city and the county to say, what are the best practices to apply to this activity? So, for example, I was on the phone yesterday with the individual that's doing this for Dallas, and having a conversation and sharing some ideas there. McKinsey, as a consulting group, has been very involved with the medical center, with the GHP, with others, And that's been I'd say, a wealth of information in terms of bringing best practices, not just from around the country, but I mean, literally from around the world as they're helping cities and in jurisdictions around the world move through this type of activity.
Well, thank you, Marvin. I really appreciate that. I want to, in just a moment, get to some Q&A from the audience, but I wanted to ask you, I mentioned earlier in the introduction that you served as the Chief Recovery Officer for the city following Hurricane Harvey, and you've been close to a lot of resiliency work. Any lessons learned from Hurricane Harvey and the work that you've seen in resiliency over the last few years that have been beneficial to us in this COVID-19? And what work do you believe still needs to be done?
Well, it's a big topic, but what I'd ask you to pay attention to, Russell, is look at what the mayor did after Harvey, because I think Harvey revealed a lot of weaknesses just across, around the way things are done, and I'd say our ability, to put it frankly, in terms of long-term thinking and resiliency. And so one of the things the mayor did was he actually put a chief resiliency officer in place for the city. So this is Marissa Aho, who has a great background in this area, and has now come into the city, has developed a resilience framework, which basically takes, addresses that compounding effect of multiple disasters on top of vulnerable communities and other vulnerabilities that we have in the Houston area, and basically put a framework around how do we address these in a very comprehensive way. And it's far too much to go through, because I mean, we're talking about, a number of different sections addressing very big topics, and this is a long-term plan. But I think, so this is kind of the first element of moving to what I would call that resilience culture in our leadership in government in this area. So I'd say very good progress, just, recognition that this is going to take a while to make some of the changes that need to be changed. But now there's a blueprint for doing that.
Sure.
And one of the things that she was able to do very quickly was to basically put an addendum to that report that's a COVID overlay on that resilience. Mm-hmm. What elements are actually the same for a hurricane as they are for, this type of pandemic. And I'll give you just one, because I think it's such a great example of how you tie immediate needs to long-term resilience. And this whole concept of digital equity or a digital divide. And I'll bring it down to my layman's terms. I mean, I'm just talking about, okay, kids can't go to school, so you try virtual learning, but the number of, tens of thousands of young people in our own community that have no access for a virtual environment makes that impossible for them, and then they fall behind, and that just compounds itself, as you can see. So using an event like this to really push up the momentum on closing that digital divide and providing that virtual learning kind of capability and capacity, which, to your point earlier, if we have another wave in the fall, we may actually need that capacity, within the next year to use. But even if we didn't and we're able to get kids back in the classroom, the schools are likely to need the ability to do some virtual, some in place, and so you can see why it's important in an immediate sense, but you can also see the impacts of closing that digital divide on our community, equalizing access in so many ways, addressing some of those systemic vulnerabilities that exist in some communities. And that's the long-term resilience piece that we're really after here. So I just think it's a great example of one that we really need to pay a lot of attention to now.
Sure. Marvin, in our remaining time, I want to take some of the questions from our audience. And my first question to you is related to testing. Are we testing for antibodies? And if not, is there a plan for testing for antibodies in the future?
So not so much right now. And as a matter of fact, as we looked at this, made a pretty clear decision that just said, basically, we're going to put serology testing or antibody testing to the side for right now. And the reasons for that, to make it as simple as possible, are that there's only a few tests that are considered to have sufficient reliability to be approved by the FDA, and there's a lot of tests out there that are not. So, if you're going out there and picking something, you got to be sure you pick at least one of the two or three best that are out there. But there's still some reliability issues around that. And then the question, given there's so many important questions that can't be answered about, are you immune? How long does that immunity last, and so forth? Literally, there are no answers to those questions. So if we were to go out, for example, and test all first responders, and 30% were shown to have antibodies, the question is, well, so what would you do different? You can't guarantee those individuals of any different level of safety just because they had something in the past. And so it's just not something we can do much with yet. So we put it to the side for a moment. I think there's a time when we know more about immunity and that type of thing where it'll come back to the table.
Mm-hmm. Mm-hmm. Marvin, during April, when we saw the peak of infection and hospitalization, how close were we to reaching the capacity of our healthcare system?
Well, I don't want to speak for the doctors, although I have learned so much from the medical professionals in this community. I think the concern was not so much that we got close to that capacity, but we were on a trajectory where it's not hard to draw the line to where we would get there. So the reason I say it that way is there was a tremendous amount of concern, even though we didn't reach the point where we were really stretching that capacity. And when I talk about some of the measures, so again, if you go to the TMC website, you will see an excellent set of measures. One of those is, very clearly how much ICU capacity there is, and how much of that capacity is currently taken up by COVID patients versus other types of patients, and then what sort of spare capacity do we have in an emergency standpoint where you can actually expand ICU capacity quite a bit. I mean, to a level that really surprised me. So we never really got to that capacity point. We're in a pretty comfortable position right now, I think is fair to say. And but you can see why the concern was there at one point in time. But it's a key measure to always keep in your mind as you're going forward to make sure you maintain plenty of capacity there. I do have to say, because again, it's a learning for somebody like me, that that what I just said tends to represent the private hospitals. You again think, for example, about the Texas Medical Center. But if you translate that to the public hospitals, think about LBJ, Bentab, some of those hospitals, they're running at a capacity on at least if I'm remembering my numbers correctly, ICU capacity of 85 to 90%. So it's a more stressful situation there. But I think, I've seen plenty of evidence. I know the medical community is pretty comfortable with our ability to share between the public and the private hospitals when needed so that we can keep that from being a problem.
Does the city have any plans for sustaining or supporting small businesses outside of the PPP assistance provided by the government?
Well, we are looking at trying to provide some financial assistance, but that's pretty limited, right? After you take away from that $400 million, after you take away the amount for contact tracing and testing and the amount that's already been spent based on response, primarily through first responders, there's not a lot of money there for that purpose. And so I think I'll give you another example here too. There was a rent relief program that the mayor announced, $15 million, and so it was significant to those that got relief from it. Not that big overall, all the city could afford, and it was, similar to PPP stories, it was gone in 90 minutes, right? So the need is just so much bigger than the available resources. I think back to this idea of connecting, the city's activities primarily to the most vulnerable communities. There is a concerted effort now going at this point, and I expect this to be, joint city-county, which will be trying to provide direct support to small businesses in those vulnerable communities. I may have said this before, where it doesn't change the economic picture for Houston, but it's absolutely key to the viability of that neighborhood and people to have a reasonable lifestyle in that neighborhood. So there will be a very direct effort focused on those businesses.
Mhm. Marvin, speaking to contact tracing and the use of cell phones, I think there is still some concern by citizens about privacy. Can you speak to that? Is there any guidelines or any policies in the works to address privacy issues and as it relates to contact tracing?
Well, I'll just tell you from a simple way that I think about it, which is, contact tracing. Number one, most important thing is get it up and running. And so it's pretty brute force as I'm talking right now. I mean, it's literally a good database to store the information in, but it's a phone call to an individual. It's direct contact with an individual, and it's getting input on people they may have come in contact with. And it doesn't include some of the electronic tools that you've heard about.
Mhm.
But I think we took the perspective that let's get this up and running. We know the brute force method works. And let's not waste any time getting it up to capacity, debating electronic tools and that type of thing. Let's get it running, and then we'll come back and think about that as an overlay if it's socially acceptable and otherwise. And I think you've seen, I think I'm not the best source of data on this, but from what I've been able to gather, just in the last couple of weeks, as people are starting to take some surveys and see some actual results in cities where they're attempting to use, the Googles and other opportunities to collect that data, that the uptake, you have to opt in, it has to be voluntary, and the uptake is pretty low, frankly. So I'm not convinced at this point that it's going to be a big part of this program. But if we can get to the point it is, then we'll incorporate it in a snap.
Mm-hmm. Mm-hmm. Marvin, throughout the country, there are over 30 million people that have lost jobs as a result of this COVID-19 pandemic. As a executive for Shell, you employed people from around the world. What are some tips or some tools or some advice that you might give for people redeveloping skills to be more employable during COVID and after?
Well, I think it's, I almost am forced to keep it pretty generic, but I mean, I think the resilience of individuals has never ceased to amaze me. And so, just providing those opportunities for changes, reskilling, whatever category you want to put it in. I think my experience and our experiences, people will really surprise you with what they can do, just given that sort of opportunity. So I think companies that can think through that, it's a very helpful thing to do. I think one of the most fascinating things happening in that space right now is nothing new because we hear about it every day, but it's the rethinking of how do people work and how do people work together, and to what degree does it become more virtual? That has its challenges as well, but there's a certain flexibility that I think we've all, in the last couple of months, sort of tuned into more, that actually does work. That doesn't replace face-to-face contact, but it supplements it in a way that, could be much more efficient for businesses, lower their cost structure, help sustain employment better because you can reduce costs in other ways. So I think that'll be a very interesting space to watch, Russell.
Mm-hmm. Given that this is an election year, and some are anticipating perhaps a second wave in the fall or winter, has the city been thinking about or planning for voting in the fall?
Well, I'm glad you came down to something mechanical and specific, because I was going to tell you, I don't get into anything specific. And one of the things, when you get a call to take a job like this, the first thing you have to register with yourself is it's a totally non-political role. I don't express a political opinion on anything when I'm this. But anyway, so the city doesn't control voting, as I understand it. I think there's a county element that does that. So it's actually not something I've touched at all. There are too many other priorities, and I haven't gotten to that.
Okay. Well, one last question. What is the day in the life of Marvin Odum these days?
Well, it's I don't know that anybody really be interested in this, but it's a combination of, if I just take today's schedule, probably 8 Zoom or Teams meetings where we're working on some of these items that I mentioned, for the city. And, whether it's, just, well, anyway, you can imagine all the different activities that we have going. For me, it's, squeezing in a board meeting here and there. I'm actually, running a company that I spent some time on that as well. That's happening in the same way because these virtual ways of working are going pretty well. So I had a pretty balanced and full schedule coming into, before I took this particular activity on with the city. And now it's kind of packed from, 7 to 7, I would say, which is not the way I want to continue in my semi-retirement, but it is such a privilege to do this. I have to say, it is, in every respect, it's a privilege to do this. It's an incredible feeling of purposefulness, and Harvey did it for me. When you see the need out there, it's an undeniable request. I didn't have to think too hard about the request.
Marvin, I am out of time, but not questions. Thank you so much for being so generous with your time today. And on behalf of everyone at the center and all of our viewing audience, and I think the Houston region, thank you so much for your commitment to working on this COVID-19. I think we're all feeling a bit more confident about how we work through this crisis, having you lead us. So thank you so much.
Thank you very much. Great to see you again.
Likewise. I want to thank the viewing audience also for joining us today, and also remind you to be on the lookout for information about next week's webcast, which will happen on Thursday, June the 4th. I'll be speaking with Reeves Taylor, Gensler, and he'll be talking about the challenges of reopening offices, returning to work, and working safely. I'm Russell Richard. Good day, stay safe, and be well.